Hi, I'm Maggie Laukent, and I'm a nurse practitioner student at Maryville University. And this is Dave. He's my patient today, and I am going to be doing a heart and lung assessment on Dave. I'm going to start out by just watching Dave's chest rise and fall and make sure that he's breathing evenly, that he's not short of breath, that he's not in any distress, and that he's breathing at a rate and rhythm that are within normal limits, and he is. He's breathing at about a 16 respiration per minute breath. I will also be checking for some of the thoracic landmarks, which are to make sure that his trachea is midline. Here's the suprasternal notch and the angle of Lewis, as well as I would check for his coastal angle. The next thing that I would be doing is I would just be palpating to make sure that there's no uneven areas. I'm also going to have Dave say the words 99 so that I can check for fremitus, which is a good thing. It just means that I can feel resonance throughout his lung fields.
99, 99, 99, and 99.
I compare both sides and it is even. Next, I'm going to put my hands in kind of a W on the back of Dave. I'm going to have him breathe in and out, and I'm just making sure that he's breathing evenly, and he is. My hands are moving together. The next thing that I'm going to come around this side of you. The next thing that I'm going to do is I'm going to percuss, and I'm just going to make sure that I can feel the resonance through my fingers. So I just take my third finger and I tap on it on both sides, and I do the lateral sides as well. And the reason why I do side to side is just to compare to make sure both lungs are even. The next thing that I'm going to do is I'm going to look for Dave's diaphragmatic excursion, and I'm going to do that by having Dave take a deep breath in and hold it, and I'm going to percuss on the back until I feel the flatness instead of the resonance. You can go ahead and breathe, Dave. And I'm going to mark that. I'll do that on both sides. Take another deep breath in. And I percuss until I find that. Go ahead and breathe out. The next thing I'm going to do is I'm going to have him breathe out and hold the no breath. So go ahead and breathe out. I'm percussing again, and I'm finding on both sides, you can breathe, Dave. I'm finding on both sides where that diaphragmatic line is. It's a little bit higher on the right side, and the amount is usually between 3 and 5 centimeters. And when I measured Dave earlier, it was 4 centimeters, so he's right within those normal limits. I'm going to go ahead now, and I'm going to listen. I'm going to auscultate his lung field, and this is done in a couple of different ways. Some people start at the top and some people start at the bottom. I start in the bottom lung fields, and for somebody like Dave who has asthma, I would be able to hear if the wheezing was deep in his lungs. So I'm going to start on his front chest just so that you can see what I'm doing. I'm going to start on the lateral sides. Nice deep breath, and out. Right up here as well. Thanks, I'll give you a break so that you don't hyperventilate. All right, one more time, Dave. Nice and deep, in and out. I'm listening for any crepitus, crackles, rhonchi, wheezing, friction. I don't hear any of that, so those are all good things. And essentially his lung assessment is negative, which in the medical field is a positive.
Yay.
All right. Now I'm going to do his heart assessment, and first again I inspect just by looking at him just to see if I can see any lifts or heaves or thrills, and a thrill is actually something that I would feel. I am just going to be making sure that the left and the right are even. And then I'm going to locate his apical impulse, which is about the 5th intercostal space, usually kind of below the nipple at the mid-clavicular line. And that would be also where I would hear the S1 sound. I'm going to palpate Dave's chest to see if I can feel, or percuss Dave's chest to see if I can feel the borders of his heart. And so you just kind of go around. Where the heart actually sits is a little more flat than those lung fields where when you percuss there's some resonance. This is actually, with today's technology, done best through an x-ray. Next, I'm going to listen to Dave's heart. The things that I will hear are the S1 and the S2. Those are the normal sounds. Sounds that I'm also looking to hear and hoping not to are 3s and 4s, which are murmurs, gallops, and rubs. So I'm going to start at about the 2nd intercostal space on the right-hand side, and you can just keep breathing normal. This is the apical spot. I'm going to cross the precordium and go over to the left 2nd intercostal space for the pulmonic. I'm going to go down to the 3rd intercostal space, and that's Erb's point. The 4th intercostal space is where I would hear the tricuspid. And the 5th intercostal space and the midclavicular line, again, is the apex of the heart. That's where I would hear the mitral. And as I listen to this and I palpate Dave's carotid, I can actually, they actually coincide. So that's a positive thing too. And that wraps it up for the heart and lung assessment. So thank you for watching, and thank you for being my patient.
Thank you.